So what does this rise in COVID cases mean? Well, two experts give us their insight now to help put a summer wave into perspective.
There's no other way to slice it. We're in the midst of a summer COVID wave. We are. It's not quite clear how big it's going to get. It's not quite clear how significantly this will impact our healthcare system, but we're in a wave.
According to Dr. Isaac Bogosh, this summer wave is driven by the BA.5 variant. It's also driven waves in South Africa, parts of Europe, and now Australia.
And it's a little more transmissible. It certainly can evade some of the protective immunity that we get from vaccination.
Public Health Ontario numbers show that while 82% of the overall population has had 2 doses, only 50% has had at least 1 booster. Dr. Bogosh is urging people to get their 3rd shot and, if they're elderly or immune compromised, to get their 4th. The vaccine may not stop you from getting COVID, but Bogosh says it will protect you from getting severely ill.
The vaccines have stood up against severe illness time and time again.
Ontario's Chief Medical Officer of Health has said people need to learn to live with COVID. Epidemiologist Colin Furness says that shouldn't mean giving up on protective measures.
This idea of living with COVID, I think, has been co-opted to let's surrender and do nothing. I think living with COVID means something different. It means regulating indoor air quality, and that will make everybody healthier. COVID can, in many people, reduce the size of your brain. I mean, it takes brain tissue with it, and you're not necessarily noticing that, but you will have cognitive decline. So we have to be careful, I think, by dismissing it and saying, well, some people don't get sick at all. We don't actually know that.
Furness would like to see better ventilation in enclosed places like restaurants. As for masks,
do we need to bring mask mandates back? And, the short answer is in some circumstances, yeah, I think we do.
However, the bigger issue, Furness says, is that people need to wear the right masks.
For the proportion of people out there claiming that masks don't work, they're partly right. There's a lot of crappy masks that don't work. Cloth masks aren't suitable anymore.
Furness recommends respirator masks like a KN95.
They've got a fabric that is really good at trapping teeny tiny particles like virions through electrostatic attraction. And you can't pretend that a regular cloth mask will do it, because it won't. That's like trying to catch mosquitoes with a tennis net.
Doug Ford has said an announcement will be coming soon on expanding eligibility for 4th doses. And NACI, the National Advisory Committee on Immunization, is recommending booster shots for those at increased risk this fall.